Why the actual camera?
Alright guys, watch the plugs right here. We're going back and forth.
Sorry.
I
don't know.
Don't
Are
even
you
worry
recording?
about that.
Are you recording
Yeah,
already?
it helps you when I grade
I was checking my clothes.
Alright, so one last thing. I will be timing you, okay, for no, I will not stop you. Okay? Huh? If you really want to. Oh wait, if you go, okay, let me clarify. If you go way over, you know, if you're approaching like a minute over, I'm gonna be like, wrap it up. All right.
When I'm presenting, I talk fast.
Okay, well, pace yourself. Okay. Right, you'll do fine. Remember, if you guys read really fast through your scripts, you're going to most of you are going to complete before 3 minutes. Did anybody do a word count on their speech? So if you're around 450 words, give or take, 20 words or so, then, towards the end, you might get somewhere you want to slow down. Okay, because around 450 words is about 3 minutes typical speaking voice. Okay, so you're not going too fast, you're not going too slow. So you'll get through it in about 3 minutes. So just know that. Be confident about that. Okay.
Use your pace.
Relax. Everyone breathe deeply.
Oh. But the testimony doesn't include within the presentation.
Every class that comes up.
So at testimony time, do we include that testimony time into the presentation? I mean, we also have a presentation.
No.
Quick.
It's not. It's a brief presentation. I'm not concerned about that.
Okay.
Okay. What you're being timed on is your actual speaking testimony. And remember why we kept it in 3 minutes?
Because we have 3 minutes on the floor.
That's what they have. Okay. So actually,
I felt like our example, they talk more. They talk in the
they
longer.
did talk more, but there are some examples that are very strict on. Like at the same one supervisor, once they get off going there to have the real experts, if you're just are you okay. All right, everybody. Give them the floor. All right. You guys are okay to say hi.
Okay, well,
All right. Go ahead, start.
our coalition is a trauma prevention coalition.
Oh, so the problem that we tackled was traumatic injuries, and injuries are one of the largest burdens of public health. Throughout the United States, traumatic injuries, both unintentional and intentional, continue to be among the top leading three causes of death and disability among individuals ages 1 through 24.
And then injuries affect populations, as we said, of all ages, despite their socioeconomic status. However, certain demographic groups may have higher risk of injuries, also depending on their region or their area. And then for non-fatal injuries, the age-adjusted rate among males is 11,545 versus 9,127 per 100,000 among females. And then the age-adjusted rates for male and female are 98.6 versus 40.4 per 100,000 respectively. Yeah. Okay.
Economic impact. In the year 2000, the total lifetime cost of injury in the United States was approximately $406 billion. Of those $406 billion, $80 billion was designated for medical treatments and $326 billion for lost productivity due to work absenteeism. A possible solutions proposed policy solution are R.880 for 115 Congress Mission Zero Act. The H.R. 880 Mission Zero Act was introduced in 115 Congress in hopes of navigating resources to allocate military trauma care providers to certain trauma centers in the country. With the level of expertise and experience in the military, such providers are expected to elevate the severity of injury. The Society of Trauma Nurses, one of the key members of the Trauma Prevention Coalition, has discussed officially endorses this bill with the argument that such funding and personnel allocation for major trauma centers in the country will receive the expertise and experience that are typically present in the military and experience settings.
So our stakeholders include the American Trauma Society, Society of Trauma Nurses, Trauma Center Association of America, and Injury Free Coalition for Kids.
So for our first testimony, I'd like to introduce Isabel to represent the American Trauma Society.
Good evening. I am Isabel Poderoso, and on behalf of the American Trauma Society, I would like to thank the Senate and the members of this committee for giving me their time to present this testimony in support of the bill HR 880, also known as the Mission Zero Act. I am here today to urge you to vote yes for the Mission Zero Act. A study conducted by Dr. Zainadine Hashmi from the Research Center of the Brigham and Women's Hospital in Washington presented that poor access to trauma centers linked to higher pre-hospital death rates in more than half of the U.S. states. This means that states with poor access to trauma centers have more deaths occurring prior to the injured patient's arrival at the hospital as compared to states with better access. According to the Centers of Disease Control and Prevention, trauma is the fourth leading cause of death for Americans aged 1 to 44, with 49% of trauma deaths occurring prior to even arriving at the hospital. This means that 49% of annual trauma deaths could potentially be prevented if given access to comprehensive trauma care from level 1 and level 2 trauma centers. The goal of the American Trauma Society is to become a major force in reducing the threat of preventable injuries by becoming an advocate for increased presence of qualified injury prevention professionals. With the help of the Mission Zero Act, the American Trauma Society can achieve this goal by creating partnerships between military care providers and civilian care providers in order to maintain a military-grade readiness for trauma victims. The American Trauma Society strives to provide resources that injury prevention professionals need in order to reduce preventable injuries and trauma-related deaths. The Mission Zero Act could assist in training these injury prevention professionals with a fast-acting comprehensive care plan that military providers and medical professionals abide by. If the Mission Zero Act were to be passed, then it would open doors for the majority of the U.S. states that do not have proper access to trauma care centers. The Mission Zero Act could provide the opportunity for survival for those 49% of trauma patients that die before even arriving at the hospital every single year. If the Mission Zero Act were to be passed, it would mean prevention of disability for those 16-year-olds who get into motor vehicle accidents, or prevention of deaths of those 73-year-old grandmothers whenever they suffer a mechanical fall. Passing the Mission Zero Act would mean saving the lives of the 150,000 deaths every single year that are due to injuries. With that note, on behalf of all healthcare professionals in the United States and the American Trauma Society, I urge you to vote yes for the bill HR 880, also known as the Mission Zero Act. With my most sincere regards, I thank you for giving me the time tonight, or for giving me the opportunity to speak this evening.
Next is Society of Trauma Nurses.
Thank you, ATS.
Good evening, and thank you to the Senate for allowing me to give this testimony on behalf of the Society of Trauma Nurses regarding the bill HR 880, Mission Zero Act. As we in the healthcare community and many others may have known, injuries are the leading cause of premature death in this country for individuals aged 0 to 45. In the past decade, there are about 200,000 fatal and over 30 million non-fatal injuries each year in average, costing our economy over $420 billion in both medical expenses and loss of productivity. Among those injuries, firearm incidents are unfortunately becoming more common nowadays. Many of us may never forget the shooting at an Orlando nightclub in June 2016 that killed 49 individuals, or the recent shooting in Las Vegas, October 2017, killing 58 individuals and injured hundreds of others. Such devastating events that involve firearm killed over 38,000 and injured over 216,000 people in 2016 alone, leaving behind a significant impact on the victims, their families, and the society in general. This poses as a significant challenge to the civilian trauma setting where high-velocity gun blasts and injuries are not as common as the military setting. In this case, while comprehensive gun control is yet to be established, it has been suggested that an integration of civilian and military trauma care may be the answer, and the Mission Zero Act shall create the foundation. Mission Zero Act, if signed into law, shall secure funding to dispatch military trauma practitioners to selected civilian trauma facilities between active combat periods where their workload is reduced. For military personnel, this will allow them to assist in selected facilities while maintaining their level of readiness through continuous utilization of their combat level expertise. For civilian nurses, not only military assistants will share the workload, they will also be able to learn from the military level expertise and experience. This integration shall enhance the quality of outcome of trauma care in selected facilities. Just as any other initiative or policy, Mission Zero Act has its cost. According to the Congressional Budget Office, if enacted in 2018, the Mission Zero Act would cost a total of $63 million over the period of 2018 and 2022, while creating neither the long-term budget deficit nor any impact on the federal, local, tribal authorities, as well as on the private sector. However, the integration of military expertise into the civilian setting might help improving the trauma care system in the country. As reported in 2017 by a committee of the National Academies of Science, Engineering, and Medicine, an optimal civilian trauma care system, including the integration of military expertise, may prevent nearly 20% of fatal injuries every year, saving billions of dollars for both the healthcare setting and economical productivity. With all that in mind, I am here on the behalf of the Society of Trauma Nurses, fully endorse and ask the senators to vote yes on the Mission Zero Act. Thank you.
Thank you.
Next is the Trauma Center Association of America. My name is John, and I'm a member of the Trauma Center Association of America. The Trauma Center Association is the premier source for trauma center information. It also advocates for more efficient and successful trauma centers across the country. As a veteran myself, I hope you can vote yes on the HR 880 Mission Zero Act. The maintenance of military trauma readiness should be the highest importance. People may ask why increased civilian military is important. Well, active duty personnel are understaffed, resulting in poor care and longer waiting times. Recent conflicts in Afghanistan and Iraq have shown major increases in trauma injuries. These trauma injuries often come with persistent symptoms and disabilities, which will take them away from their service. Expanding trauma centers is a critical source for combat medical readiness should be a goal, so that service members can rejoin the fight sooner. By receiving the funding, the bill provides military hospitals can outsource members to civilian trauma centers to provide more efficient and quality care. In 2011, the DoD reported 20,000 cases of TBI, traumatic brain injury. These cases should be treated efficiently for the security of our nation. However, trauma collaboration is not a benefit for just military. Civilians will be able to use this resource as well. The biggest killer of our youth and working age population is injury. By allowing military to have trauma care providers in civilian sectors, the treatment of injuries will be more successful and reduce the rate of injury-related deaths. The lessons military doctors teach civilians will also benefit civilians at home. Lastly, should there be a disaster anywhere in our nation, natural or man-made, military trauma providers and civilian providers will provide a more successful medical response because they have seen more extreme injuries in combat. Thank you for allowing me to speak in support of this important bill.
Thank you.
Good afternoon, good evening, and thank you for the members of the Senate, subcommittee, and co-sponsors for allowing me to give testimony on behalf of the Injury-Free Coalition for Kids in reference to Bill HR 880 or the Mission Zero Act. As previously outlined, trauma and associated injuries is a major contributing factor to the workload of healthcare trauma centers nationally. The integration outlined in this bill discusses accessing military trauma teams who possess the most up-to-date and advanced trauma and healthcare training to serve, assist, and advance the care of populations containing generations of youth in this country. The Injury-Free Coalition for Kids has 42 member sites within level 1 trauma centers across the United States. and heavily counts on the ability of these sites to efficiently and effectively treat pediatric and adolescent trauma patients. The CDC tallies that on average 12,175 children ages 0 to 19 years of age die each year in the United States from unintentional injuries. As well, an estimated 9.2 million children annually visit emergency departments for unintentional trauma. The overwhelming need for the trauma practitioners in numerous regions negatively affects the care that is received. And I can personally appreciate and attribute this very real issue as a parent of 2 small children who have required emergency care from the Rady Children's Hospital Center in San Diego. This trauma center serves as the pediatric trauma hub throughout my home community of San Diego, with a population of 3,288,612. And it is partnered with the Injury Free Coalition for Kids as a member site. The County of San Diego 2016 trauma report cited that 766 per 100,000 patients ages 0 to 15 sustained trauma injuries requiring medical intervention. And in 2016 alone, there were 9,820 patients delivered to trauma centers in San Diego County, all requiring medical trauma care. The California Medical Board and Labor Department, as well as the County of San Diego, shows less than 3,000 professionals who are tasked with treating the 9,800 children injured yearly. The incorporation of numerous and highly trained military trauma practitioners would positively affect the care and outcomes of thousands of patients in just this region alone. I implore that the members of this committee contemplate the overall health care benefits this bill would allow for the children in need of traumatic care. And lastly, I would like to refer to the National Center for Health Statistics, who in 2006 shown that unintentional injuries were the leading cause of injury death for children and adolescents. Also, a 12% increase between 2013 and 2016 has also strained the healthcare community and instilled a dire need for additional practitioners. Members with advanced training could additionally train and improve the standards of care that are current practicing professionals. HR 880 Mission Zero Act contains a suitable and required solution to this very real problem. As a parent, advocate of trauma prevention, and a member of this great nation, I urge you to vote yes on HR 880, the Mission Zero Act, and enable places of care the best ability and opportunity to treat the children of this nation and our future. Thank you.
Hey, thank you. Thanks for breaking.
Do we turn on our testimonies?
No.
Okay.
No.
It's a record.
Yeah.
That's your own personal. No need to turn it.
I'm gonna pray.
How do you want tape?
I'll put it on my fridge.
All right. Who wants to go next? Brady, you guys want to go next, right? Yeah. Okay.
Spoil my way. 2 hours.
When you have children. You see me up here? You're down there. We're not going to cover with the backline symbol. We're already up there. Oh, okay. There you are.
I set it up for us.
And we got stuck in traffic.
Exiting.
I feel like
Bye.
that
was for 435.
Well, it's funny, we were watching in class. Midland.
Were you up there first?
I was,
We were first or second.
yeah, I think we were like second.
Oh,
I saw myself.
especially if you decide to go into the recording.
Yeah.
Okay.
And I, what? Go for it. Right. I'll start.
Hi, we're doing public.
Away from the podium. Start. You can use my clicker. Yeah. It should be right there. There it is. You guys can click on here. Here, that's fine, just like that. Just so you're not all behind.
It's like a safety net.
30 in colors.
Well, usually there's not a clicker though, so somebody, you know, usually.
Right.
Yeah. We did public policy and alcohol. Sorry, I'm a little bit sick, you guys. The Lorraine Sheen Alcohol Tax Coalition, which is a statewide coalition in the state of Maryland. Healthcare for All is one of the main coalition chairpersons. They published all of the information on it, most of the information. So the scope of the problem: misuse and dependency of alcohol has serious consequences, not just for the heavy drinkers, but for other people surrounding. So this includes moderate drinkers, non-drinkers, children, adults, elderly. It runs the whole gamut. It also has serious economic burden, as we'll get to later. Misuse and dependency, there's no huge difference between racial and ethnic backgrounds. It's pretty much even. The highest one, the highest ratio was among Native American populations, but even that was just slightly more than the other groups. By socioeconomic, the more money you have, the more likely you are to drink. However, the effects of misuse and dependency is disproportionately affects lower socioeconomic groups, including including the physical manifestations, cirrhosis, thank you, and things like that. Men do drink more than women. It's pretty significant. However, in recent years, there's been a trend to show that women are starting to catch up with men at the rate of drinking. Underage and college attending kids, this data is specifically troubling because college students are more likely to binge drink and engage in excessive drinking than their peers who are not in college. And underage drinkers consume more drinks in one event than adults who are of age. Finally, heavy drinkers, as I said, heavy drinkers and moderate and non-drinkers are all affected by this trend. This includes vehicular accidents. There's a huge trend in violence, either by the drinker or towards the drinker. This includes homicide, sexual assault, child abuse, and anything of what would be a changed behavior, erratic behavior that would result in violent tendencies.
So the economic impact from alcohol tax comes from a number of different factors. Work loss, workplace loss, and injuries, and you see a bunch of different factors in those. It is $4.1 billion in total, or 1.96 or $1.96 per drink in Maryland, or 223.5 billion, or $1.90 per drink nationally. 72% of those losses are from workplace productivity. The rest come from, like I said, medical losses and things like car accidents. Yes. There's been a number of different articles written on this, the effects of alcohol tax and press policies for morbidity and mortality. Science Daily has a higher alcohol tax, and CNN has put out multiple news reports, like their study on paying more for alcohol tax. Alcohol saves lives.
So what is presently being done in the possible solution? So the Lorraine Sheen Alcohol Tax Coalition, which is what we've been presenting about. So together they're working with Healthcare for All in Maryland, and they are working together to support the bill, Senate Bill 944. So the Senate bill would work to increase the sales tax on alcohol from 6% to 9%. So that 3% would go to underfunded programs for people that are on waiting lists that are chronically ill. So 15 million of that would go towards that group of people. It would save an estimated $249 million in costs associated with law enforcement, hospitalization, and treatment programs. It would also decrease alcohol consumption by 5% and potentially decrease alcohol dependence by 15,000 people annually. 37 less people per year would die from deaths caused by drunk drivers. Senate Bill 944 ensures that 15 million is allocated to the local community service programs. And like I said, the critically underfunded waiting list for people with developmental disabilities. So these are our stakeholders. I will start with the National Council on Alcoholism and Treatment. Hello, my name is Brittany Dillman. Thank you for having me here to speak on a matter of Senate Bill 994 to increase the sales tax on alcohol. I represent the National Council on Alcoholism and Drug Dependence. The NCADD has been in operation for 74 years. We have pioneered public interest in alcoholism with our roots starting in a single office out of Manhattan that was run by a woman named Marty Mann. Marty had a vision to change the perception of alcoholism through her organization. She single-handedly changed the conversation about alcoholism through her policy change. NCADD was able to cast alcoholism and drug dependency as a medical problem rather than a moral problem. I am here to support the passing of the Senate Bill 994 for alcohol tax supported by the Lorraine Sheehan Coalition. I ask you to vote yes on passing this bill. According to research from the Center for Disease Control, alcohol misuse is a major problem. 88,000 people die per year due to excessive alcohol use. Johns Hopkins did a study on the benefits of the alcohol sales tax. They found that increasing the cost of alcohol by a dime would cause a decline in alcohol-related expenses, reduce addiction, and alcohol-related deaths. The tax would save the state an estimated $249 million in costs associated with law enforcement, hospitalization, and treatment programs. Alcohol consumption would reduce by 5% and potentially decrease alcohol dependence by 15,000 people annually. Johns Hopkins furthered the support of the tax by determining that 37 less people per year would die from deaths caused by drunk drivers. The numbers speak for themselves, and that the tax would reduce deaths, decrease the economic burden, as well as reduce addiction. Alcoholism does not discriminate. More than 23 million people over the age of 12 are addicted to alcohol and drugs. That is almost 1 in 10 people. When I was a child, my family was affected by alcoholism. My uncle suffered for many years with an addiction to alcoholism, and he lost that battle in 1994. He died from alcohol-induced cirrhosis of the liver. A statement my grandfather said to me has stayed with me since then. It was that no parent should have to attend the funeral of their child. My grandparents had to bury their beloved firstborn son because of his addiction. The impact that alcohol had on my family is detrimental. My grandparents lost a child because of it. It is the responsibility of the NCADD to advocate for people that suffer from alcoholism, and it would be a huge success in the eyes of NCADD to see the alcohol tax pass. The bill would potentially save lives and spare them from the grief of seeing their family members suffer from addictions or illnesses related to alcohol. And like my grandfather said, no parent should have to bury their child. This tax would see that less people are attending funerals of their family members, and more people are living the lives they were meant to fulfill. Thank you.
Good, thank you.
Here from the National Institute of Alcohol Abuse and Alcoholism. So, good evening. My name is Tyler LeBlanc. I'm a representative of the National Institute on Alcohol Abuse and Alcoholism, here on behalf of the Lorraine Sheehan Coalition. I would like to thank you all for giving me the time to speak with you today. I'm here to ask you to vote yes on Senate Bill 994, National Institute on Alcohol Abuse and Alcoholism. As a member of the National Institute of Health, our mission is to create and disperse important information on the effects of alcohol abuse. We use this knowledge to improve diagnoses, disease prevention, and the treatment of alcohol-related problems, including alcohol use disorder. We have been the lead federal agency responsible for scientific research on alcohol and its effects for over 40 years.
We are the largest funders of alcohol research in the world, and our goal in this coalition is to study and educate on the economic, medical, and personal burden that the abuse of alcohol can have on both Maryland and the entire population of the United States. Excessive alcohol abuse can be a costly public health issue in the United States, especially in Maryland. According to the American Journal of Preventive Medicine, excessive alcohol use costs around $4.1 billion, which is around $1.96 per drink in Maryland. This number is higher than the national cost of excessive alcohol use in 2006, which was $223.5 billion, or $1.90 per drink consumed. These losses were attributed to a loss of workplace productivity, healthcare expenses, criminal justice-related expenses, and other effects. Binge drinking is defined as having 4 or more drinks per occasion for women, or 5 or more drinks per occasion for men. Binge drinking is responsible for about 3/4, or 77% of the total cost of indulgent alcohol use in the United States. Underage drinking was responsible for 27 billion in cost, and drinking during pregnancy, 5.2 billion. The CDC estimated in 2010 the economic cost of excessive drinking totaled $249 billion, or $2.05 a drink, 5 cents a drink, which is up from the rate of 2006. By raising the alcohol tax, we can help to reduce this binge drinking trend, and this tax can be a deterrent against purchases. Alcohol taxes are enforced at both the state and federal level. These taxes are beverage specific, meaning they are different tax rates for beer, wine, and spirits. Because alcohol taxes are often based on number of beverages purchased and not the sale price, their effects can diminish due to inflation over time. For this reason, it is important that they are adjusted regularly. Knowing that, please consider this. Maryland has not raised its tax on spirits since 1955, and its tax on beer and wine since 1972. I would like to thank you for your yes vote on Senate Bill 994, and again for your time.
Good, thank you. And finally, the Mental Health Association of Maryland. Good evening. I'd first like to thank you for inviting me to speak on this matter today. My name is Raven Richmond. I am here on behalf of the Mental Health Association of Maryland. We are a volunteer-run, nonprofit organization operating for over 100 years that works to improve the lives of and monitor services for those living with mental health disorders and substance abuse problems. The association also works with and shares many other groups where mental health intersects with other concerns. Today I am here because of the relationship between mental health and alcohol misuse and dependency. We urge you to vote yes on Senate Bill 994. In this way, you will be helping the Mental Health Association of Maryland see our vision that includes a humane and healthy society that affords everyone to achieve their full potential. The American Psychological Association classifies substance abuse and addictions as a mental health disorder. Half of addiction is due to genetics, the other half is influenced by social, psychological, and environmental factors. Combined with regular or chronic use, functions of the brain involving reward, motivation, memory, impulse control, and judgment are critically altered, leading to a cycle of increased use and or radical behavior changes. This is especially troubling when underage drinkers with still developing brains misuse alcohol, leading to developmental deficiencies that may be lifelong, as well as a risk for depression and suicide. In Maryland, approximately 25% of high schoolers report binge drinking. Among 15 to 20-year-olds, alcohol is the cause of death in 1 out of 3 cases. The National Institute of Mental Health states that suicide is the 3rd leading cause of death among 15 to 24-year-olds, and Maryland saw 1,219 completed suicides in youth ages 10 to 24 between 1990 and 2006. And it is estimated that anywhere from 100 to 200 attempts are made for every single completed suicide. Not only is alcohol abuse a warning sign of suicide, but excessive use of alcohol can alter the brain to increase the risk of suicide. The CDC states that excessive drinkers are more likely to commit suicide than non-drinkers, and the trend is also true when considering only those underage. Between 2006 and 2010, 17% of all acute deaths due to excessive alcohol were suicides. Annually, there are over 4,300 alcohol-related deaths of youths 21 and under, with 6% of them result in suicide. Not only should we be concerned for the immediate consequences of alcohol misuse and suicide, but also of their future. Youths who engage in drinking are more likely to develop alcohol misuse problems later in life. This tax bill aims to avert cases of alcohol misuse and alcohol-related injuries and deaths, as well as to reduce drinking among heavy drinkers and our young people. Help our youth, help our communities, help our state. Vote yes. Thank you.
Good. Thank you.
Tonight we are going to be talking about the Big Cities Health Coalition, especially the immunization equity.
Okay, so the problem that we're, I gotta go find a pen. So the
Yeah, you
problem-
guys come away from
The problem that we're facing and how we're working towards with big cities is funded a national immunization program authorized under Section 317 of the Public Health Service Act. What's important about this is that from the CDC and prevention, including the Senate bill, vaccines are one of the greatest success stories in public health, and they're also among one of the most cost-effective ways to prevent disease. We know and understand that the return on investment for each dollar invested in the U.S. childhood immunization program, there are over $10 of societal savings and $3 in direct medical savings. Also, childhood immunizations are, over the past 20 years, have prevented 381 million illnesses, 855,000 early deaths, and $1.65 trillion in total societal costs. The CDC estimates that vaccination of children born between the years 1984 and 2013 will prevent 322 million illnesses and help with 732,000 deaths. Still, approximately 43,000 adults and 300 children in the United States die annually from vaccine-preventable diseases and their complications.
The affected population, unfortunately, purchasing vaccines is not enough to protect an entire population. A robust immunization infrastructure is required to support programs such as Vaccines for Children, which rely on the critical infrastructure and operations funded through Section 317 to effectively serve as target population. 54% of American children, nearly 45 million, who get their vaccines for free every year through this program. The Section 317 program also serves as the backbone of our nation's public health infrastructure, supporting the science that informs our national immunization policy, providing a safety net to uninsured for adults for vaccine purchases, monitoring the safety of vaccines, educating providers, and performing community outreach, and conducting surveillance, laboratory testing, and powerful epidemiological response to disease outbreak. I got the clicker.
Oh,
Yeah.
the economic impact. In 2014, the CDC reported 644 cases of measles across 27 states, the largest number of cases since the elimination of measles in Toronto. CDC estimated that it will cost more than $140,000 to contain each individual case of measles. Unfortunately, that outbreak was not the end. During the spring and summer of 2017, a new outbreak in Minnesota left 71 people, 73 of whom were children with measles. The Section 317 program supported the rapid response effort and continues to support local and state public health custody for surveillance, detection, and response. Providing state funding for the Section 317 program in fiscal year 2019 would ensure access to cost-efficient prevention, measures to help keep Americans healthy.
Okay, so the policy solution is a bill in the Senate would allocate $670 million for immunization programs authorized under Section 317 of the Public Health Service Act. The funding would provide vaccines for children and low-income adults, as well as support public education programs that emphasize the role of vaccine in disease prevention.
Good afternoon. My name is Jessica Aristizabal, and I'm here today to represent the California Department of Public Health's Immunization Branch. Before I begin, I want to take the time to thank all of the board members for giving me the opportunity to talk to you about the Public Sector 317 Immunization Program. Implemented in October of 1962, it has served as a safety net for individuals who are underinsured or might not have the funds for vaccinations across the years. As of 2012, the 317 program extended its resources to underinsured and uninsured adults. This was done to reach low-income communities, since these individuals are more susceptible for having multiple risk factors for the development of communicable diseases. Vaccines help reduce morbidity and mortality through the prevention of disease transmission. In order for any immunization effort to succeed, knowing the health disparities within the program's locality is key for compliance rates to increase. Healthy People 2020 defines a disparity in healthcare as a particular health difference closely linked to social, economic, and/or environmental disadvantages. This places adults with low income at a higher risk for facing these disparities. Excuse me. Furthermore, according to the U.S. Census Bureau, in 2017, the poverty rate in the U.S. was 12.3%. That amounts to 39.7 million people. Of that 39.7 million, 28.5 million people did not have any type of health insurance coverage. On my right, I have a graph that represents the data from a study done in Kaiser Family Foundation. And what I want you to really focus on is that from the years 1997 to 2016, although uninsured rates decreased in adults aged 18 to 64, in 2016, we still faced with 12% of the population not having health insurance coverage. In fact, the Centers for Disease Control and Prevention stated that this year, 1 in 5 adults are well below the national goals for adult vaccinations. I urge you to vote yes, so that we are better prepared when it comes to providing vaccinations for underprivileged populations. Before I close, I want to leave you with the story of Tomas Viera Gomez. Earlier this year, Global News reported that Tomas, a dangerous criminal from Brazil, kidnapped 2 nurses along with a large amount of vaccination equipment and took them to one of the most low-income sectors in Rio de Janeiro. He ordered the medical staff to inoculate the people within the area against the vaccine-preventable disease, yellow fever. The moral of the story is that we as Americans are fortunate to have the funding and programs such as the 317 immunization program to cover and protect our low-income communities. As a representative of the California Department of Public Health, I'm here to enforce our mission in regards to immunization by providing leadership and support to all immunization efforts in order to protect all of the California's population. Thank you again for letting me speak tonight.
Good evening, Director and Committee. My name is Nick Rodas, and before I begin, I just want to start off by saying thank you for allowing me to speak to you on behalf of this matter and for giving me your time and attention. On behalf of the National Association of County and City Health Officials, I ask that you please vote yes for Section 317 of the Public Health Service Act. By voting yes for Section 317, a bill in the Senate would allocate $607 million for immunization programs for children, low-income adults, and to support public health education programs that emphasize the roles of vaccines and disease prevention. Most importantly, this policy has been directed towards meeting the needs of underinsured children and that are not eligible for the VFC Vaccines for Children program. The VFC is a program that is federally funded entitlement program that provides vaccines at no cost to eligible children. Section 317 allows children that are not eligible for the VFC program to receive their proper vaccinations. So this bill will allow for great opportunities and funding for all of this. I would like to focus on how this will most importantly positively impact children and how vaccination programs in schools are crucial for children while also affecting their parents. By having funds available for vaccination programs in the schools, there is more opportunity to provide vaccinations for children in schools that need it and for those who cannot simply afford it. Providing vaccines in alternative settings such as schools provides access to children who may not otherwise have the opportunity to be vaccinated at all and offers a convenient option for parents to have their children get vaccinated without having to arrange for a healthcare provider visit, which in result means no time off for work for the parent and no time off from school for the children. Providing vaccinations in schools has contributed up to an 80% reduction in non-compliance in participating schools, as well as parents have stated that this is a great option for their child's follow-up doses of vaccines such as the HPV vaccine or their annual flu vaccine, which may not have been available when they were at their doctor's office back to school visit. By ensuring that students at these participating schools are vaccinated, we are contributing to the protection of the greater community against vaccine-preventable diseases. An example that I would like to provide mentions the state of Hawaii. Hawaii has the largest school-based influenza vaccination program. From 2007 to 2008, 90% of all 377 schools in the state immunized over 40% of the 146,777 students in those schools. Vaccinations can save the lives of children, prevent severe morbidity, and lower healthcare costs for families. This is why I'm asking you to vote yes for Section 317 of the Public Health Service Act. The Section 317 immunization program will continue to be the backbone of the United States childhood immunization program. We need funds available to ensure that children vaccination is accessible, safe, affordable, effective, and efficient to protect our most precious natural resource, children. Thank you, Director and Committee, for your time and attention.
Good evening, everyone. My name is Vic Schobel. On behalf of Big Cities and the Debbie Mount Foundation, I'd like to thank the committee and the committee chair. Thank you, Professor, for having us today. The Debbie Mount Foundation mission is to advance policies, education, build partnerships, and strengthen public health to create communities where people can achieve their best possible health. We talked about the savings and the return on investment. I'd like to talk about some of the things we asked for you guys to vote on today. In 2016, the CDC submitted a report to Congress which shows that Section 317 program is not adequately funded to serve its public health function in its essential manner, protecting Americans from preventable but dangerous diseases. Providing this vital funding, 317 in fiscal year 2019 would ensure access to cost-effective prevention measures to keep Americans healthy and safe. As you move into conference for the fiscal year, we urge you to fund the National Immunization Program authorizing under Section 317 of the Public Health Service Act, the Centers of Disease Control and Prevention, including the Senate bill. So 317 is very important for many reasons. I understand that many of you came here today thinking that you're voting on a bill, but you're actually voting on much more than that. You're voting on our future, and you're voting on a change. So on behalf of the Debbie Mount Foundation and Big Cities, I'd like to conclude our presentation with that. Thank you.
Good job, you guys. All right, I think we have time for at least one more group. Who wants to go next? Come on, get it over with. Go, Rania.
name is Jetta, and this is Rania. And then our collections for today is collection against tobacco for minor. Let me see if I'm. The problem, the tobacco use has been incredibly prevalent for generations, and the tobacco industry has been efficient in its marketing and distribution of the product. In the United States alone, smoking is the leading preventable cause of premature death and disease, yet individuals continue with their tobacco use. Who has been affected? The affected by tobacco use are infinite, and the scope of the burden of the disease and death that tobacco use initiate is extensive. In 2016, more than 15 of every 100 U.S. adults aged 18 years or older currently smoke cigarette, which means that unestimated is 37.8 million adults in the U.S. smoke.
All right. Here's been written. So there have been many articles written on the harmful effects of tobacco on minors, as well as policies that are in place to prevent it from happening. Many tobacco users started tobacco at an early age. It's reported that 9 out of 10 smokers tried their first cigarette by the age of 18. In 2009, the Family Smoking Prevention and Tobacco Control Act restricts tobacco marketing sales to minors. Even with this law, a National Youth Tobacco Survey revealed that 60% of minors said it was easy or somewhat easy to get their hands on tobacco.
So our policy solution is the Senate Bill X2-7, which is tobacco products minimum legal age. In this bill, the existing law of the STATE Act, or Stop Tobacco Access to Kids Enforcement, is being extended to ensure that the product is not available to persons under 20 years of age. The law previously stated 18 years of age. This bill also authorizes the State Department of Public Health to conduct random on-site inspections of tobacco product retailers with the assistance of persons 21 years of age. So our stakeholders consist of Food and Drug Administration, U.S. Department of Health and Human Services, and Hello everyone, my name is Rania Peruga, and I am here representing the Food and Drug Administration's Youth Tobacco Prevention Plan as part of the Coalition Against Tobacco for Minors. Thank you all so much for taking the time to allow me to speak to you all today about a preceding issue that must be addressed. I am specifically asking you, the legislation, to vote yes on Bill X2-7, which contributes to prohibiting the sale of tobacco to anyone under 21 years of age. We hear it all the time. The youth are our future doctors, lawyers, teachers, etc. It is absolutely essential for us to help initiate a tobacco-free generation. Almost 90% of adult daily smokers started smoking by the age of 18. And more than 2,300 youth under 18 smoke their first cigarettes every day in the United States. It is understood that use of tobacco products, no matter what type, is almost always started and established during adolescence when the developing brain is most vulnerable to nicotine addiction. The marketing and advertising geared especially towards the younger generation is the main contributing factor of the prevalence of tobacco use among youth. The FDA's Youth Tobacco Prevention Plan helps to prevent youth access to tobacco products, while also curbing the marketing of tobacco products aimed at the youth and educating teens and retailers about the dangers of using tobacco products and their key role in protecting the youth. Through the FDA, we see powerful scientific evidence that flavors play a key role in youth initiation and continued use of tobacco products, including cigars and electronic cigarettes. The FDA's own research found that 81% of the kids who have ever used tobacco products started with a flavored product, including 81% who have ever tried e-cigarettes and 65% who have ever tried cigars. The youth also cite flavors as a major reason for their current use of tobacco products, with 81.5% of youth e-cigarette users and 73.8% of youth cigar users saying that they use the products because they come in flavors I like, unquote. These industries intentionally market to kids and young adults. Increasing the tobacco age to 21 will help counter efforts of tobacco companies from targeting young people at their most critical stage of their life. We must act promptly to stop the flood of flavored e-cigarettes and cigars that have entered the market in recent years and threaten to addict a new generation of kids. And we can first do this by allowing Senate Bill X3-7 to pass, first prohibiting children from attaining these products. We must take it one step at a time. It is crucial for us to help to continue to reduce early loss of life, costly medical care, lost wages, lower productivity, and increased disability, and more importantly, protect our children and our future generations. Thank you for your time.
Thank you.
Good evening, everyone. It is a great honor to be here with you all tonight. My name is Jeda Pintor. I want to thank you all in advance for giving me the opportunity to speak on behalf of the U.S. Department of Health and Human Services. I am proud to be part of the Coalition Against Tobacco for Minors, and tonight I am advocating on behalf of Bill SBX 2/7, which is about tobacco products, minimum legal age. Tonight is about doing whatever we can to ensure our children are protected and educated against the harmful effect of tobacco products. Acting now can help save millions of dollars in unnecessary health care costs related to smoking-related disease. Therefore, I am asking you to give your full support for the Bill SBX 2/7, which will change the age to legally purchasing tobacco products at the age of 21. According to CDC, about 4.7 million middle and high school students use at least one tobacco product, including e-cigarette. Every day, more than 3,800 youth Americans die prematurely of smoking or exposure to secondhand smoke. Another 16 million lives with a serious illness caused by smoking. Each year, the United States spends nearly $170 billion on medical care to treat smoking-related disease. Living here in the United States has helped me realize that we all could make a difference. Before I decided to pursue my education, I was working as a certified nursing assistant. Many of my patients were open to share their personal stories. Some of the patients were there as a result of a smoke-related disease. Most of them started smoking at the age of 13 or 14, which is unacceptable on this day. Many patients died, others got better, and went away to continue smoking cigarettes. Last August, my Aunt Amelia was diagnosed late with cancer. She started smoking at the age of 14. My aunt had cancer in both lungs and her liver and died 2 months later. Now my uncle, who is a heavy smoker, is refusing to see a doctor or seek treatment, is likely to follow her within a few months. Smoking addiction is very powerful, and the will to quit rarely overcomes the need to smoke. I understand it is hard to tell people what to do. Allowing the tobacco industry to target the youngster without heavy penalties is neglecting our duty to help our communities. Children need to be protected from themselves sometimes, and they are relying on us, the adult in this room, to point them in the right direction. So once again, I am asking you to vote yes for this bill. Thank you so much for your time.
All right. Good afternoon. My name is Quinn Warren, and I represent the Tobacco Free Kids organization as a part of the Coalition Against Tobacco for Minors. I would like to start out by thanking the legislation for their time and allowing me the chance to speak here today. We are a nonprofit organization who has spent the last 20 years trying to reduce the devastating effects of tobacco on our youth, not only in the U.S., but around the world. I'm asking for the legislation to vote yes on Senate Bill X2 Tax 7. This act will prohibit the sale of tobacco to anyone under the age of 21 federally, which will reduce tobacco use amongst the youth and hopefully make the next generation tobacco-free. According to the American Lung Association, in 2016, more than 1 in 5 high school students in the United States use at least one product. Additionally, 7.2% of middle school students use at least one tobacco product. This is a troubling number considering the legal age to purchase tobacco is at least 18. In Needham, Massachusetts, the legal age to purchase tobacco was raised to 21. As a direct result of raising the legal age, teen smoking dropped from 13 to 7% between the years of 2006 and 2010. The smoking rate in Needham, Massachusetts is also 50% lower than it is in the rest of the state. In another article written by the American Lung Association, smoking is the leading cause of preventable death in the United States, killing over 480,000 people per year. In addition to killing hundreds of thousands of people in the United States every year, tobacco is a massive financial burden. The National Institute of Health concluded that smoking costs more than $300 billion per year. Over $170 billion is attributed to direct medical costs, and $156 billion is spent on lost productivity and premature death. By voting yes on Senate Bill X2, Tax 7, we are countering the effects of tobacco companies who are targeting our youth. We are also keeping tobacco out of our high schools. Most importantly of all, by voting yes on Senate Bill X2, Tax 7, we are significantly reducing the number of adolescents and young adults who will start smoking. The goal of the government is to provide for and protect the citizens. We humbly ask you to vote yes on XB X2 in order to protect our children from tobacco. Thank you for your time.
All right, so great work so far. Right, we are 4 groups in. We don't have enough time before our break to do another group. How many of you are in favor of taking the normal break? Or how many of you would like to just push on through and have a break afterwards? So those in favor of breaking now, raise your hand. Breaking later, raise your hand. All right, so let's go ahead and break now. Let's come back at, why don't you guys take an extra 5 minutes? Let's come back at 7:25. 7:25. Come back. And we'll finish up.